Hi, I'm a 41-year-old mother living with sickle cell SC. I have 5 children, two sets of twins, one set 24, the other set 17, and I have a young one that's 6 and a half. Um, my experience with my sickle cell, I can remember in my younger years, I would get sick and have a lot of joint pain in my arms and in my legs, and my parents not knowing what it was because I wasn't diagnosed with sickle cell at birth. Like now, they are automatically test African Americans for sickle cell once they're first born. So you pretty much know right away if you have sickle cell, if you're a carrier of sickle cell. Um, it took them, I want to say, about a year to figure out that I had sickle cell. Um, they didn't find out I had it until I was about the age of 13. So I guess around 12, I began to have my problems and my flare ups. Um, Throughout my life, I've had blood transfusions. Um, I've had pneumonia several times. Um, I have some joint issues going on right now, which is all directly related to my sickle cell, especially with my shoulders. Um, Through technology, though, medical, study, the studying of medicine and with all of that going on, sickle cell patients are beginning to live longer than they ever have. Um, like I said, I'm 41, and I can remember when I first found out I had sickle cell. I remember reading a book, and it said that as a sickle cell patient, you wouldn't live past the age of, I want to say, 22. So I feel like I've surpassed that already. So, but through a lot of medical research and the different meds, we we're starting to live and survive longer. Um, Daily meds, I take folic acid every day, once a day. I was on vitamin D and I was on potassium. Um, how does it affect me? Well, I get pain crisis, not frequently, but I get pain crisis in the joints, and it will cause my joints to ache, and that can be in my arms, my legs, my chest. Um, I normally control my pain at home with different pain meds, as far as ibuprofen, anywhere from 600 to 800 milligram. Um, um, a stronger med also, which would be Percocet. I think like a 5 milligram. Um, yeah, a 5 milligram. And if I'm unable to control it at home, that's when I go to the ER. If I go to the ER, I get an IV. They start an IV. They take blood work to check my levels. Um, they treat me with oxygen, um, fluid, and IV meds. And that's pretty much how you get rid of the pain. Never really get rid of, basically they just treat the symptoms. Me personally, for me to be 41, I think I'm okay with my sickle cell. I don't have a lot of hospital stays and a lot of hospital visits. Recently, though, I caught the flu, and on top of the flu, I had pneumonia, and on top of that, I guess my blood count had dropped really low, and I had to get 4 different transfusions within a week. I believe that's the sickest I've ever been. It took me a while to bounce back. It took me about a month and a half to bounce back. Um, Sickle cell has not stopped me from doing anything because I never put limitations or boundaries on myself because of my illness. I have one daughter that does have sickle cell. And with me growing up with sickle cell, I always promised myself that I wouldn't let her I wouldn't put limitations on her by saying, oh, you can't do this because you got sickle cell, or you can't do that because you got sickle cell. So, my daughter, she has no limitations on her. She's 24. She hasn't been hospitalized for her sickle cell in quite some time, and I want to say since she was younger. We both manage ours pretty good at home. Once again, like I said, I don't let it stop me from anything. Sometimes I get, a little tired, or sometimes I go into my pain crises. And when I do, it knocks me down for a minute. But after a while, I'm back up and I'm back moving around. I think me having sickle cell when I was younger, I was very rebellious because I used to say, like, why do I have to have sickle cell? And I didn't understand it. And they used to tell me all these things that I can't do because I had it. And so I always promised myself when I become an adult, if I make it to see an adult, and if I ever have a child, that I would never put those limitations on them. And because of that way of thinking, I don't let my sickle cell hinder me from doing anything. As with anything, though, or any disease or any handicap, you got to work within your boundaries. So I know the things that I can't do, and I know the things that may exacerbate my sickle cell. So I try to avoid those things. Extremely cold weather gets me really bad in the wintertime. So I kind of stay out of the cold so much. The summertime, it can get me if I don't stay well hydrated. Like I said, I'm pretty in control of my pain. I manage my pain really well. I used to go to Children's Hospital when I was younger, and they set us up with something at Curative where they showed us how to manage our pain without meds and coping mechanisms that we can do. So my coping mechanism to get past my pain is to listen to my music in my headphones, and and take my meds and relax and chill out, and that's how I get through it. And that's about it. Like I said, I'm 41. I'm a single mom, 5 children, 2 sets of twins, 24, 17, and a son that's 6. Out of my 5 children, only one of them has sickle cell disease, SC, but all the other children do have the trait. And once again, they have 2 different fathers, and both of the men I had children by both had sickle cell trait. I think sickle cell patients get a bad stigma of being drug seekers or drug addicts. I think they kind of put us all in one box or one category, because there can be that few, as with anything, that you do have those bad seeds in there. That's the downfall of it. But a way to avoid that is to maintain your doctor appointments and meet with your doctor and see your doctor often. I get seen at the sickle cell clinic pretty often. So I don't have a lot of crisis, and like I said, I'm able to manage my pain really well. Dr. Fields, a matter of fact, over at the sickle cell clinic at Freighter, he's my doctor. Great doctor. I have nothing negative to say, and he's very open, and he doesn't push things off on you. I know a lot of the sickle cell patients take hydroxyurea. I don't take that, but I know a few that do. Once again, I know that some sickle cell patients, a few can make it seem bad for others because of the narcotics that they prescribe. I guess a lot of them may be considered as drug seekers because they go from doctor to doctor to doctor to doctor. And to avoid that stigma, stick with your doctor. You have your doctor, you see your doctor often, you and your doctor develop a good rapport and a good relationship, and he knows you well enough to know that, okay, this is my patient, and you don't have to worry about running out of your meds, because I never run out my meds. And if you do run out your meds, you can always contact your doctor. That's about it. Thank you.